Welcome back to the Hippie Martha Hormone Hour, where we talk about cycles, hormones, and what it means to truly support women's health across the lifespan. I'm Ashley, your host, and today I'm joined by Danielle Kepics, a functional diagnostic practitioner who has over 10 years of clinical experience as a physician assistant, training in counseling psychology, certified fertility educator, PNL1 nutrition coach, and as a personal trainer. She takes a functional and whole person approach to care. She works primarily with high achieving, type A women between the ages of 30 and 50 who are done chasing symptoms and ready to build sustainable, optimal health. And as always, here on the show, we're grounding this conversation in the menstrual cycle because the cycle tells us so much if we know how to listen. Before we dive into gut health, metabolism, and all the things, I want to start where I always do, which is by checking in with the cycle and Danielle. So let's begin there.
Ooh,
Hi, welcome.
hi. You want me to talk about like what cycle day I'm on and what's
Yeah,
going on?
so
Love
so
this.
typically we
I
do like
love
a cycle
this.
day check-in. Yeah.
Okay, so this is extra interesting for me today because I actually just went and had labs drawn this morning because I'm on cycle day 4. So I just finished my period. And for anyone listening, there are multiple points in your cycle where you can test hormones. Like you can't just test willy-nilly at any time with women, right? We're not like men where we ride on this 24-hour clock and it's like just make sure you go in the morning. It's this whole production. I went this morning. I had some other blood markers tested as well, but went and got my FSH, LH, and estradiol levels checked to see kind of where I am because I'm going to be 42 in March. I do my hormones once to twice a year at this point. Things can change really rapidly in perimenopause, so but I'm feeling really good. I did say before we started recording, I did a later workout yesterday, which I knew I was playing Russian roulette with my sleep, but I knew I had this blood draw this morning and I had to be fasted. And so it throws off how you eat. So I was like, I'm just going to go and do my best to get good sleep. Sleep was like super fragmented is the word I'm looking for
Yeah.
last night, but I feel really good otherwise.
Awesome.
Happy to
Yeah.
answer
Yeah,
questions about
thank
that.
you. No. I feel you. I go like once a year as well. It's very, it's always good to see where we're at. And it's funny because I will be 42 in September. So leading into all of this, do you want to just say a little bit about what you do for clients? I know you have like this huge, long, list of unique credentials, but how did your career evolve into you running your own integrative practice, and what kind of clients do you actually see?
Yeah, so as far as how I'll talk about how I got here and then I'll talk about the very common person that comes to me. How I got here. So I've been in health and fitness my whole life and I like to say that this all really started with my mom got cancer when I was young and I was really determined to do everything I possibly could to be a healthy human and avoid struggling with cancer. So tell me you turned your trauma into your career without telling me you turned your trauma into your career. Hi, hello, I'm walking it. I like to say that. And also, I'm not super obsessive either. Like I still do the things I want to do with my life. It doesn't hold me back. It pushes me forward, right? To allow me to my health to allow me to live the life I want to live. And so it really all started there. And then I went to college and I would largely say that I had no idea what I was doing and I got a degree in psychology. I knew that I wanted to help people and I'm very interested in human behavior and paying attention to why do people do the things that they do, and I like to say that I'm also a toddler who never grew up. I continue to ask why, which really it's super helpful as a clinician because really that you're just constantly asking, you need to ask the right questions or you're not going to get the right information, right? So
Yeah.
I went on to get my master's degree in counseling and I was like, this is not super fulfilling, super expensive way to find that out. Don't 12 out of 10, don't recommend, 0 out of
Oh
5
my
stars.
gosh, yeah.
Yeah. And so then I was working as a personal trainer and someone told me about the PA career, physician assistant, physician associate. I don't really care what you call it. It's, tomato, tomato to me. And I got accepted to my number one choice. I went to PA school at the University of Pittsburgh and I graduated there. And I did travel PA work for a while. And so, like, when you do travel work, you don't really get immersed. Like, you're there for 3 months and you're out. And at my final job, before I did what I'm doing now, I just really I started to see people a lot, like we're currently, right? I wasn't just seeing them once or twice while I was filling in for somebody or while an office was trying to get up and running, etc. And I just started to see how the system wasn't set up to support people and women specifically with their needs with hormones and gut health and all these things. And it was just a pill for every ill. And I grew very increasingly frustrated about it. And, it's funny because I started my last job before I opened my business, literally 3 weeks before the C word started. And that whole process, for a myriad of reasons, which if you really want to know about, I'm happy to talk about, but just really drove me away from conventional medicine. I was like, you know what, what are we doing here? And so my initial business, which I still own both LLCs, and I can talk more about that later, but Empowered Medicine really started, which is now Empowered Mind and Body, because I went more towards the functional integrative side and away from prescribing, but was started as I really wanted to be like a medical doula to help people talk to their doctors to be more effective. And then some things happened where I wanted to bring fertility awareness to my last job, and they basically found my Instagram, told me that I wouldn't be able to work with gynecologists, to which I appropriately told them that I don't need the help of gynecologists to do what I'm doing. And they pretty much threatened me. And I was like, I will walk out of here for good. And less than 3 months later, I was out. No, I want to say, I'm sorry, it was about 8 months later that I was out for good. And I really started pushing. And I was like, you know what? I cannot work in an area where I cannot serve people where they get what they're not getting what they actually need, right? And so I started my business, which is where I do like the integrative health coaching and things like that. I work as a functional diagnostic nutrition practitioner. I do not like practice medicine through there, but is Empowered Mind and Body. And I really work to serve the person who has been disserved by conventional medicine, who has issues that they've been told are normal. Oh, your labs are normal. We don't know what's wrong with you. Just go on the birth control pill, take this pill for your diarrhea. For the person who really wants a deeper dive into their health, who's like, I want to do the stool testing and I want my fasting insulin tested and I want to know things before they go wrong. I'm really working with the people who, the tagline for my business is be the CEO of your own health. So women who want to be the CEO of their own health. You don't have to be between the ages of 30 and 50, but most of the women who come to me they fall in that range, most of them. I do have some clients who are younger and some who are older, but who just really want to be the CEO of their own health, are frustrated with the status quo, are sick and tired of being sick and tired, and they're sick and tired of being fed bullshit by the conventional system. So
Absolutely. No, I left the hospital in 2020, like right as it was starting, and I ended up working with midwives in home births, and I was just so done with it too. I feel you.
yeah.
There needs to be something to fill the gap. And I'm so glad that we have practitioners like you that can help with that and do that. So thank you for doing that.
Yeah.
You say like women between 30 and 50, obviously there's outliers. But do you also say type A women? So
Yeah.
how does that personality show up
Yeah.
in the body?
This person usually shows up with the person who is, I'm doing all the things, because typically the women who come to me need to be doing a lot less. And I'm happy to talk more about that. As I'm getting into my 40s, I'm really, really finding how less is more. And it's been a long time since I've been over exercising and overdoing it kind of thing. And, without, I stretch my means because like I have to live and I have to do things and get stuff done. Really, it's the person who they're like, but I'm doing all the things. I don't understand why any of it is working. And then that's kind of the thing that they're saying about what is being represented in their body. And then, I mean, these symptoms could be all over the place, but typically it's across multiple body systems. So typically I'm seeing issues with energy. They're wired and tired. They're sluggish at 3 p.m. They're reaching for the cookie jar. They don't understand why they're gaining weight. They're sleep is very fragmented on a regular basis, right? Like all of the time. They're waking up between 1 and 3 a.m. So there can be blood sugar dysfunction too there with the energy, heavy, painful periods, missing periods, aside from like late perimenopause when periods start to get irregular because of natural course of biology, right? Lots of gut issues. I find a lot of SIBO, a lot of GI dysfunction. Many GI physicians still will not test for SIBO. I do not understand it.
That is so freaking wild to me.
It is.
I don't understand.
I don't either. So I deal with a lot of gut drama. I fix a lot of gut drama for people, subfertility, infertility. Yeah, I mean, it can really show a lot of thyroid dysfunction. Many of my women are under eating and over exercising. And that is something that I feel very passionately about because it drives everything, right? Like exercise is a stressor and women are just not thinking of exercise as a part of that stress bucket and how that fits into the puzzle of like, what can I tolerate? They're just really trying to like do as much as possible, right? They think because everything else, if you think about, if you're trying to learn how to play the guitar or learn how to speak a language, the more you practice, the better you get at it, right? And so many things in our society and just life in general, the more you do, the better you get, the better results you get, and you're rewarded for that. That's not the case with exercise. And I would say that's especially not the case with exercise as a woman in her 40s, which, it's been an
Yeah.
interesting journey thus far for me.
Well, myself included, there was a point where I literally was so exhausted, like I couldn't move. Like a
Yeah.
walk would just drain me. And we can lead into this too, like the whole gut issue. I see a lot of gut issues on women, with my intake forms when they come in and they're like, I have hormone issues. I'm like, well, you really have a gut issue. Like, you don't have just hormone issues. Why do you think gut dysfunction is so incredibly common but mistreated?
I mean, so why I think it's so common is because, I mean, your gut is your second brain, right? And so there's a lot of different things that can impact gut function. So your nervous system can impact it, what you eat impacts it, how you sleep, your stress levels, different types of stressors that you have coming at you. Like all of those things impact how our gut is able to function. We know that our brain communicates to our gut and our gut communicates to our brain. So there's a lot of inputs that it's taking in and that it has to deal with, and a lot of things that have to go right. I always say, like, I'm always really pissed off when something goes wrong with my body because I'm like, I give you vegetables, I walk you, I give you sunlight. How dare you, you whore. And
Yes.
at the same time, it really is amazing how everything works in coordination for things to function well, right? Like it's amazing, and it's like also how dare you in the same sentence. I can say put both of those things together. That's why I think it's so common. And then what was the second thing that you asked me?
What do you think is causing it? I
Oh,
can't think.
yeah. I
Yeah,
mean,
like
so for the women that I see specifically, under eating, because if you don't put shit in, shit don't come out. Literally, pun intended, literally and figuratively. If you don't put enough things in your mouth, you're going to have decreased motility. Number two is the quality of foods that people are eating. I find that women are they're either overdoing the fiber, which can cause constipation, right? Or they're underdoing it, right? They're not getting enough fiber, which is
mhm.
super important for bowel movements. Water, electrolytes, lots of those things all play a role in our gut function. And then one of the biggest ones I think too is just, a lot of other like when we talk about SIBO, there's a lot of underlying causes for that people aren't talking about. So thyroid issues, did you have previous surgery? Lyme disease because it affects the nerves in the gut. And, conventional testing for Lyme disease sucks. It's not good. It's not accurate. It doesn't pick up every single case. If I said prior surgeries, I'm just trying to think of like other common, like, I mean, Alzheimer's, dementia, Parkinson's, anything that affects your
Yeah.
nerves or muscles could be a root cause for SIBO. And that's being ignored in a lot of cases. The most common cause that I see as a root cause for SIBO is post-infectious IBS. So you had a GI bug, had it coming out of both ends, and you said, my God, you know what? I've never been the same since I had that GI bug a couple of years ago. Things just have, quote unquote, things haven't been right. And so people develop SIBO and they continue to have these struggles. There's so many different types of gut issues too, but I would say also the biggest overlooked one is nervous system. I
Yeah.
mean, people are eating while they're driving, they're not chewing their food adequately, they're eating in a distressed state, they've got their phone in one hand and their fork in the other. So a lot of the times the basics, I
Yeah.
wouldn't say fix 100% of gut issues for people with me, but it really brings people a long way to having more regular bowel movements. And then I would say the other thing is just they're dismissed. They're told by their doctor, like, just take Linzess, or you have a Miralax deficiency, which, I mean, I know doctors aren't actually saying that, but that's literally what they're saying when they say just take Miralax. Okay, but what's actually
I
causing the
cannot
problem here?
stand Miralax. Like I'm
Me
like,
either. Stop
stop.
it.
Stop
Stop.
prescribing.
God.
Oh my God.
Like the system has really created practitioners who have no critical thought. There's no critical thinking. It's check these boxes, do these things. This is the algorithm that you follow. Do not deviate. And so that's also a massive problem. And then, people trust their doctors. Like my boyfriend always says, doctors, PAs, NPs, cops, lawyer, like people, those are types of professions where they have inherent increased public trust, is
Mhm.
how he describes it. And so you trust your doctor because they want the best for you. And I'm not saying that these doctors have ill intention. And I'm also done giving them a free pass. I'm so sick. I'm so sick of hearing, oh, but they're doing their best with the time they have. No, they're not.
Because they're not
Because
given enough time.
because
That's,
it
I mean,
literally,
yeah.
it's not even that. You have a 6 to 7 minute appointment. You can talk to somebody for 2.5 minutes about their eating practices. You can print it out.
Yeah.
Have make the forms. It literally took me, I was doing a post today on insomnia and, just how doctors are handing out like, and I mean, medications too cause all kinds of GI distress, right? Like the people dancing on the commercials, but you may shit yourself. Great. And, it's ridiculous. And so the medications cause like a ton of side effects either. I'm not saying, stop your medications or whatever. I'm just saying ask questions. And I'm done giving these prescribers a free pass about like, oh, well, we only have so much time. Boo-hoo us. You know what? I did the same fucking job and like do better.
Yeah.
Like you can take 2 minutes and you can say, "Hey, do you sit down when you eat?"
Right.
Wow, that took 6 seconds. Hey, do you know how many times you chew each bite of food? Can you put your fork down between bites? These basic meal hygiene things that can make a huge difference. And you can literally, it doesn't have to be any like, Kaiser Permanente or whatever, or Mayo Clinic saying it can be like a little half sheet of paper that you make or that your medical assistant hands out to people that says basic meal hygiene.
Yeah.
Give that to that person and see how. Listen, I'm not saying that they're going to do it. People are also the problem, but I am so done with giving prescribers a free pass because they don't have the time and they're so overburdened. I know, I get it. I did the job. I worked in primary care for almost 10 years. I get it. It's go, 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 figure it out. And I do a much better job now than I did then because I do have more time.
Right.
And I realize that, the amount that you're doing is going to look different, but you can do something before you start whipping out your script pad for Ambien or Linzess or Miralax.
Absolutely. I couldn't agree with you more. And honestly, all of those things that you mentioned, I started doing, I learned from Chinese medicine. I work at I work at like an acupuncture place and they were like, "Well, have you tried cooking your food instead of eating raw foods?" And I was like, "Oh, like things that you don't even think about, like going back to the basics." And I love that. And honestly, I think that's what healed my SIBO more so than any protocols that I did, like 8 months of SIBO protocols. So granted, it didn't hurt, but definitely, I think healing that nervous system. And I think so many people miss those little things. So
Totally.
let's see. Can you explain the gut hormone connection and how issues in the gut can show up in the menstrual cycle?
Yeah, so I like to tell people that how your period shows up is the tip of the iceberg. Like you don't have hormone problems, you have things causing your hormone problems. Like the hormones aren't the problem. They're responding to the inputs that you give it, right? And so just kind of like the things that we were talking about with gut health, right? Like if you have like poor bacteria balance, if you have overgrowth, if you have H. pylori, SIBO, like that's a stressor on the body and your menstrual cycle, she don't like that. So that's a big part of it. And then there's another part where we can talk about gut hormone connection too, in the sense that there is an enzyme in the gut called beta-glucuronidase. Anything that ends in ASE is an enzyme. This basically shuttles out, or I'm sorry, recirculates estrogen and toxins, right? And so most of our estrogen metabolism is happening in the liver, phase 1 and phase 2. Phase 3 happens in the gut, which is why we can test on stool tests based on that beta-glucuronidase marker. Now, if you have too much of it, you're recirculating too much estrogen. So lots of women can have issues there. And it's also super taxing to the liver. And like I said, I'm like kind of going in a circle here, but phase 1 and phase 2 happen primarily in the liver. And so if we're needing to bring that stuff back and back and back to be recycled, to go through the system, you're going to have more strain on that liver, which is really so it's just kind of it's a circle jerk of issues there. Yeah. So when so many women come to me and they say I have such bad hormone issues, or I have hormone this or hormone that, and I'm like, okay, we need to start understanding this differently though, because your hormones are literally the why things are happening, or the thing that you're seeing, and then the reason is underneath, right? Yeah. It can be anything. Gut dysfunction. It's usually a myriad of things of, they're not sleeping enough, they're overstressed, they're under eating, or if they're even eating enough, they've got nutrient deficiencies. And so lots of different things. Drive hormone chaos. And I will say it does typically take at least 3 months to see a difference in hormone symptoms because of the development of the egg. We call that folliculogenesis process. I have seen women see improvements sooner than that, depending on how diligent they are, but I don't know where I was going with that. There's the point.
No, that's good. That's good.
It went out the window.
That's okay. No, I will say that I think the number one test that if women come to you and they have hormone issues, or if you are having hormone issues, I think a gut test is a great place to start because it really can give you an overall picture. It can kind of tell you where your hormones are, where your thyroid is, like just how all these other systems in your body are functioning based off of what you're pooping out, which is kind of crazy to me.
Yeah, it's wild. For hormones, I would honestly say the number one thing that I see be the root driver of shit hormones is women under eating. Period. The
Yeah.
end. Like it is massive because so many women think, oh, I'm eating 2,000 calories, like that's enough. And well, I've got women who are they're hitting the weights hard 4 or 5 days a week. They're running, they're training for marathons. They want like all this like extreme stuff. And I'm like, homie, 2,000 calories is literally fueling you for Netflix and chill and nothing else. Like my basal metabolic rate is 1,600 calories. That means that if I literally do nothing but lay on my couch, I don't even gesture, right? I don't even make hit. I literally lay there and convert oxygen into carbon dioxide. My body needs 1,600 calories a day to maintain its body mass, the
Yeah.
size that I am right now. Now, if I want to do other things, I need a lot more calories than that, right? And so I use this really good graphic that it's basically your body's to-do list. And when you are under eating, the first thing that your body is not going to want to do are luxury items, luxury tasks. Ovulation is as bougie as it comes. She is like Mariah Carey. She is drama. Okay. And when you do not give your body the energy and the nutrient macronutrients and the micronutrients that it needs, it's going to say no. Or even before that, you're going to have maybe irregular cycles, painful cycles, heavy to light. Most women think like, oh, my cycle's only 2 days. That's great. That's a problem. So really, really, I do a lot of deep dives. And, I'm not a dietitian. I have a decent amount of nutrition education, but I know what under eating looks like and I know what disordered eating looks like very, very clearly. And a lot of my women come to me like, I eat exactly 61 grams of fat every, and I'm like, oh,
Yeah. Well, and
okay.
I think it's important to note that you don't have to be a nutritionist or a dietitian in order to fuel your body. You can completely understand this information is for everyone. Like it's not, you don't
Yeah.
have to be a fitness instructor or a trainer or whatever. But you can fuel your body. And I think I find so many women who are like, well, I don't want to gain weight. I'm already like doing all
You
this.
know what?
Like,
I don't want a pelvic fracture from osteoporosis. That's what I don't want. A lot of people don't realize this too, but when you undereat, you put yourself at risk for that. That is one of the risk
oh
factors
yeah.
and part of, low energy availability in the female athlete triad. But if you suffer a hip fracture after the age of 65, you have a 1 in 4 chance of dying from a complication. Death, literally 25%
Hmm.
just from that. So I think we're going to see a lot of this from the people who just stayed on Ozempic and didn't want to wanted to lose that last 10 pounds. And they were just so obsessed with how skinny they were.
Hmm.
Like we walk around with our scale number, like how much we weigh on top of our head as an identifier, right? We're going to have a lot of problems. I think the millennials and especially the elder millennials are very divided into, I don't want to gain a single pound and I can't be X weight. And then there's the other part of us who are like, I'm just trying to prevent hip fractures.
Yeah.
Like I'm not trying to die from a
Right.
hip fracture complication. I'm trying to like beefcake up, okay?
Yeah.
And so I think that the other half of us are going to be rudely awakened when they find you hear so many women who are like, but I exercise all the time. I don't understand how I have low bone density. Surely you've been fucking under eating as long as Oprah's been on TV. Like that's the problem. That is the problem. Your over exercise is also the problem.
And they're not doing, a weight resistant, right? Like you
No,
need
think Pilates
certain,
is weight training.
I
Not.
mean, it's
Stop.
not. You need weight and you need more than just 5 or 10 pound weights. Like you
Yes.
need more. And I used to work ortho trauma. So that's what, as a
Oh,
nurse, that's what I went into initially as a brand new nurse.
oh
I
shit. Okay.
I saw those women who were dying and it was
Uh-huh.
sad. It was
It is
really
sad.
sad. And the doctors would just prescribe 1,000 milligrams of calcium and think that they were preventing osteoporosis. And little did they know. And granted,
They ain't preventing shit.
this is like 20 years ago, so I just dated myself. But like, it's just, yeah,
It's bad.
it
I
is.
could go on.
It is. I
I
know.
hear
It is
you.
really bad. So, well,
I hear you.
leading into metabolic state, I know you just created a metabolic type quiz. Do you want to share more about that and
Yeah.
like how you created that and what it is used for?
Yeah, so so I created it because it's funny because when I started my business, I was really kind of on this like weird precipice of I was 37 or 37, 38. And so I was still working with a lot of like period problems and like younger population than like as I've aged, my population has too, and I've shifted more into that perimenopause, menopause, metabolic health type range. So just giving people more tools to serve them. And so the whole purpose was like discover your metabolic type, right? So like if you're well supported, if you're under supported, I can't remember the four types that I created in there. I think stress was the other one, and then blood sugars. Like undernourished and like overdoing it, stress, and then blood sugar roller coaster were the other three types, and then well supported, which is basically like, hey, like you're crushing it, like your metabolism is flexible. And basically it gives people additional tools based on their type. So it'll like link them to a freebie of mine, whether it's stress, blood sugar, and then what was the other one? There's another freebie that I put in there too. I think maybe two of them were stress, but to help them kind of figure out like the next steps to do of like, hey, like if you come out with this metabolic type, like these are some things that you can do like right now, like blood sugar, right? Like, so like
Yeah.
if you got the result of like you're on a blood sugar roller coaster, like we're going to be talking about things like eating 30 grams of protein with breakfast, eating 1 gram of protein per pound of lean body mass throughout the day. We're going to talk about eating at regular intervals, walking after meals, like giving people really tangible stuff and education behind like what's causing that, whether they're under supported, whether they're overstressed, whether they have like a blood sugar issue, right? So it's really quick too. Like it literally takes like maybe 3 minutes to complete. So that
Awesome.
would be like a really great thing to, if you want to link in the show notes for
Yeah,
people to take as a resource.
absolutely.
So it's kind of like what it is and why I created it. And then it gives, it gives everybody kind of something for free that they can start working on right now, because I've been saying this for a long time and I wish I would have started saying it sooner and louder. The mitochondria is the powerhouse of the cell, and that's really what fuels our metabolic health. And if that goes south, like everything gets quite literally fucked.
Yeah.
Like your cells are the building blocks, your mitochondria are the building blocks for your cells are the building blocks for your tissues to the organs to the organ system, right? So like if we don't have the energy to fuel and make the ATP to do the things, that's where we get dysfunction and breakdown. So having a well-oiled metabolism and a well-supported flexible metabolism too, right? Where this looks like, oh, I can eat a hamburger and not, go out for cheeseburger and fries and not freak out, and I'm not gaining all this weight. Not that anybody's going to gain weight from one meal, but like having the metabolic flexibility to do those things because you have muscle on your body, because you're sleeping on a regular basis, your mood is stable, you're eating at regular intervals. Like all these things create a well-supported metabolism, which is really the goal, because if you have a well-supported metabolism, you're going to be a healthy human.
Yeah.
Like I just don't know anybody that I've ever met that I'm like, wow, their metabolic health is great, and then like they were a dumpster fire.
Right. Yeah, absolutely. And I think it matters a lot for cycle health too, because I mean your egg is like has the most mitochondria in your body,
Yes.
right? So
Yes.
like you're also supporting that health. And then if you're healthy enough to ovulate, then you're healthy enough, like you have at least decent metabolic
Totally.
support. So,
Totally. People don't know that about like the ovary, the egg that ovulates, the follicle that ruptures. The follicle has the most, like you said,
yeah.
mitochondria per cell. Any other cell in your body, the second closest is your cardiac muscle.
Yeah.
So like
So,
that goes to show you what an expensive process that is. So like if you are starving yourself or you are trying to constantly lose weight and you have period problems, that's why, homie.
yeah, absolutely.
You ain't giving
And
your body no energy.
well, and going back to the whole weightlifting thing, you need muscles for metabolic health. If
Yeah,
you don't, everything is just going to kind of go down from there. So, yeah, strong is in, I feel like, rather than skinny, how they say. I don't know. I don't keep up on the trends. I'm just like like you said, I want to be able to open a can of pickles and, be able to
totally.
climb up on my counter and get things down from the shelf. Like, I don't know.
Yeah, man. I totally agree.
Okay, so you said earlier that you were taking hormone replacement therapy course. I want to know kind of your thoughts on bioidenticals and synthetic, and how long, like I am not anti hormones. I think if we need them, we need them. If we need to replace them, we can replace them. I definitely use cycle tracking and mapping to kind of identify that support, especially with my middle aged women
Mm.
and myself. But what are your thoughts on bioidentical versus synthetic first?
I think there's a lot of confusion on those terms, right? So like bioidentical is going to mean anything that is equal to what your body produces. And you can get this at CVS or Walgreens. It does not have to be compounded. And I think that that is a really confusing thing for women. If you are getting things like Premarin or Prempro or anything like ethinyl estradiol, all of that is synthetics, like IUDs, birth control, Prempro. There's a progesterone type that is synthetic, or another progestin. I can't think of the name right now. But yeah, I mean, synthetics I don't really understand why people would utilize them. I mean, I get it. People with birth control, like, you don't want to get pregnant. Things are super unpredictable in perimenopause, and that might be a reason why. But birth control aside, it doesn't really make sense to me because it is very accessible and it is really cheap and affordable
Yeah.
to get the bioidentical, like, and that just means same as your body produces, right?
Yeah.
So if you see anything like a progestin, like levonorgestrel, MPA, like methyl whatever
Hmm.
the depot shot is, I can never
Yeah.
pronounce the word. And there's like five different generations of classes of progestins. Several of them are more similar to testosterone than they are to actual progesterone, and yet we give them to women with polycystic ovarian syndrome who have elevated androgens. So, like, make that one make sense. I have
Yeah.
no idea.
Well, and I've seen it where people will come to me and they're like, well, they just put me on a birth control
Huh,
until I go through menopause. And I'm like,
huh, stop
that
it.
that doesn't make
Stop it.
sense.
Stop it.
So how do you
We
know when you're in menopause?
They don't. And so many women are so afraid to come off of it because they've been on the birth control pill
Mhm.
since they've been 16. And I'm, again, so sick of these doctors and other prescribers who are just like, yeah, you can take the birth control pill for 30 years. What clinical trial do we have that says that it's cool to do that? There's none of them.
No.
We are the longest. Medicine hates women. I really, truly believe this, because it's like, do you know that vaccines mount a stronger response in women than it does in men? Do you know that statins and Ambien should be written at lower doses? Women don't know this, and doctors don't follow it. And we don't have different vaccine dosing for women. But, like, and women have more autoimmune disease. And what do vaccines do? They hit the immune system. Like, why is that a thing? It's critical thinking ability. And when we look at, how women are being treated in the medical system, we do not have the long-term studies that say that birth control is safe for that longer, that it doesn't affect fertility. And all these conventional gynecologists who you see screaming on the internet are like, birth control is totally fine. We're all on it. And I'm like,
Like,
okay, what study? Like, where are the studies that say that this is safe? They weren't done.
and your risk of blood clots, DVTs, all of that shit goes up after 30.
So riddle me this. The conventional gynecologists who are probably have turned this off by
I'm
now if you were
sure.
listening. We can hand out birth control, which is synthetic, like it's candy, but yet at the same time we're talking about how estrogen causes cancer, and which is not the case. It's absolutely not true. And they're like just villainizing HRT, and they won't give it to their women, or they're telling them they have to wait until they're absolutely 12 months post, like, no period. They're actually postmenopausal, which is just so untrue. There's so much we can do with HRT in the perimenopause population is actually, I would argue, who needs it more, because
Yeah.
I talk to so many women who they're like, once I got done with menopause, like, I was fine, but my God, did I struggle in my 40s? Well, no fucking shit. And I think us millennials are like, we have had enough. We have seen so much. We are done. We watched the Twin Towers come down in our high school classes and middle school. We are done, and we are not doing this. Give it to me now, or I will go somewhere else. And
Yeah.
I am just like, thank God.
Yeah, I agree. What I'm finding too is a lot of my clients are having a hard time getting prescribers. Like, people, they will not prescribe. And so
Yeah.
that's like the other issue on the other side is everything looks normal, like you said, everything
Yeah,
is
and
fine.
so here's the other problem with prescribers is they don't understand how to test hormones, so they say you can't test hormones, so they won't test hormones. The other thing is that if they are doing HRT, they don't really understand how to do it optimally. So they're like barely scratching the surface, right? They don't know that, you really want to see an estrogen level in the blood above 70. We have studies that show this to prevent bone loss, right, for bone health.
Mhm.
And I personally think we don't have these studies yet. I think in the next 5 years, we will see reduced risk of cardiovascular disease, reduced risk of dementia. Why is it that 2 out of 3 individuals with Alzheimer's are women? No
Yeah,
one, like, why are we not, why is there not a billboard on every corner about that? Why are we not thinking about, like, hey, maybe the lack of estrogen is a problem here, right?
right.
And there's a lot of prominent people. Dr. Lisa Mosconi is a wonderful Italian researcher who, I can't remember, Maria Shriver. She's partnered with
Yeah.
her in her institute. She wrote the XX Brain and also the Menopause Brain. Both don't love her nutrition info. I think some MDs should just not
Same.
with the nutrition, but she's lovely and she is doing the Lord's work with that. And I think in the next 5 years, we're really going to see a lot of discussion of it's weird, like these women on hormone replacement therapy, we're seeing less dementia and
Bone
less
fractures.
cardiovascular. Like we know that already though, right? And so I think we're going to start seeing that. And I think that there are so many inappropriate SSRI antidepressant medications written for women who actually need their hormones
Yeah.
replaced. And if they had their hormones replaced, they would feel a whole hell of a lot better. And we have a whole generation of women who have been sloughed off by their doctors, and it's terrifying and it's awful. And I started looking for myself, right? Because and I couldn't find somebody. So this is brand new. Is I kept my Empowered Medicine LLC, and so I'm starting that as a hormone replacement because I can do
Right.
that in Utah because all I could find were these fucking nurse practitioners who all they do is aesthetics. And they're
Hmm.
like, oh, we also offer hormone replacement therapy. I'm like, you
It's
don't know what you're
pellets.
doing. And it's always
It's
pellets.
always
And we can talk about why pellets can be problematic or why, and things like that, or why
yeah.
it's not my favorite. And there are a few people who do it right. I will say that. But I was like, I found that ChatGPT is actually a really helpful way to find good HRT practitioners.
Oh,
I've helped many clients that way. Like, hey, find me HRT practitioners. None of this like 12 months without a period bullshit. Focusing on perimenopausal women, optimize. Like, if you ask it the right things, it will return the things to you. I could
yeah.
not find anyone in the state of Utah doing it. I said, fuck that, I'm doing it.
Yeah. Good for you.
So I mean, like, listen, this is not a cheap endeavor. Like to I'm basically talking about operating two completely separate businesses, and it's costing me like 8 grand to get that
Yeah.
off the ground between legal documents and branding and website, and that like it's a lot. But I was like, I cannot handle the idea that women are going to these fucking aesthetic clinics. I can't.
No.
My Oura ring's probably clocking so much stress right now because it works. I have to like go meditate after this because it works me up so hard that like women think that that's good HRT.
Yeah. Well,
Get
and they don't
fucked.
know the problem is they don't know any different. And I think when I see clients, they come in and I have them start charting their cycles. I'm like, well,
Yeah.
let's see where things are. Are you
Yeah.
even ovulating? And
Yeah.
then go from there. And then once they get on it, okay, well, you don't really necessarily need, maybe as much estrogen as you think, or maybe you need more based
Yeah.
on ovulation. So like I try to like coach them through pairing it up and cycling it, especially during perimenopause, because we still want to support, our cycle as long as possible. And I think that's
Totally.
where we go back to the mitochondria is if you're supporting mitochondria health, then you're going to support that egg quality and you're going to have a longer, healthier cycle long
Totally.
term for long-term vitality. So, yeah, it's wild though. It is just a free for all, I feel like, especially I'm
It's
in
really
the state
bad.
of Michigan. There's so many different people prescribing, just like, and they come to me
Well,
and they're
and
like,
the
what?
other problem is that like women are settling because when
Yes,
they find somebody who will actually do it, they're just like, I'll take whatever you can give me. It's
right.
like the person who's on the street desperate for drugs and they're like, "Oh, I know that that's not the really good stuff, but I'll take whatever I can get."
Yeah.
Right? And I get it. This is not the woman's fault. I totally get it. And also like you don't have to set there are other practitioners who actually know what they're doing, who actually care about hormone replacement therapy, and it isn't like this side, hey, like we do all this aesthetic stuff, but by the way, we also just do this because like we know it's going to bring you in to give you
Right. We
money.
want to
And
keep you young.
listen, I'm not against people making money. I'm a huge fan of capitalism. Like any business owner who
Yeah.
disses capitalism and says, I'm like, you're literally a hypocrite, but okay. But you can also serve the person to the level that they deserve to be served with what they're paying you. And I was so frustrated when I saw that and I was looking, I was like, I've had people begging me to do it. And so I was like, you know what? I just need to do it.
Yeah. So will you only be able to practice in Utah then?
Right.
Yeah.
Well, so here's the thing. I'm starting with Utah
Yeah.
and I have a lot of different ideas about ways to expand. That's probably going to be 1 to 3 years in the making, I would guess. But in 2027, a PA pact, a physician assistant pact, is supposed to pass that if I apply and I get accepted, which there's no reason why I wouldn't, I would be automatically licensed in I think 16 other states, 16 or
Nice.
17 other states. However, I have full optimal practice in the state of Utah, and not every other state is there. So if they require a collaborating physician, I would have to have one in that
Hmm.
state.
Yeah.
And so it gets very confusing and very muddled. And I hate this bullshit with licensing because it's like just make it nationwide. If I can do it in Utah, I can do it in New Jersey.
Yeah.
It's such a money grab and it's so stupid. I mean, I'm gonna have a whole fucking spreadsheet about like what license and when and who's the collaborating physician and what am I
Yes.
paying them. I have to have a legal document with a collaborating physician in every state that I'm licensed in. Like I have to pay for all that stuff. And
Yeah.
so and I want to do those things. And I've also thought about, there's other I can hire on other practitioners and prescribers and things like that. But yeah, so that's set to launch around April for between all of I'm finishing up my legal documents now and I've not actually even like announced that to like really anybody yet.
Oh,
But
fun. Yay.
it's some people have I've because I started a separate Instagram account and so people have found it and it's
I
it's
think
it's
it's
in the
just so
works.
necessary. Like you said, it's hard to find good quality practitioners that know what they're doing, that know you could be needing hormone replacement therapy, but also you need those basics. You might need gut health to support it. You might
You
need
can't you can't throw
like
HRT on a
right,
dumpster fire.
exactly.
It's gonna be a disaster. And
So
that's
for
the
those that
thing.
go,
I'm just saying, like, people think that HRT is going to fix their problems, but like, if you're still skipping breakfast and you're eating like a toddler and you won't go the fuck to bed at night, and you're staring at your screen for 12 hours a day, like, HRT is not going to fix that.
no.
You still have to do the foundations. Like, you cannot skip over foundations for anything, in my opinion. And I think we're seeing that a lot with these GLPs, and I think we're seeing it a lot with hormone replacement therapy too. It's being done wrong, and it's not.
Mhm.
They're overprescribed, and I'm not hormone replacement therapy, but the GLPs are overprescribed and undersupported. There's no counseling about nutrition. There's no end game. There's no mental health questions. There's no screening for like, do you have an eating disorder? Do you have disordered tendencies? It's just, oh, you're 140 pounds and you want to lose weight. Here you go.
Yeah,
Here you go.
it's wild. What do you,
It's
what's your take on GLP-1s?
I think that they are very overprescribed and undersupported. I think the fact that we have 20,000 new prescriptions a week is absolutely insane. I think that prescribers need to be held accountable for the eating disorders that they are allowing to continue because when I'm seeing and I see it all the time and I hear it all the time 140-pound women who just want to lose that last 10 pounds and they've been dieting literally since Oprah's inception or longer. It's ridiculous. And like literally if you just ate to support your metabolism and to like put on some muscle on your body, you would look better. You
Yeah.
would lose that last 10 pounds and you would be healthier. And so I think that in a lot of cases, in the majority of cases, I would even say we are allowing exercise behavior and disordered eating and body dysmorphia, which has an ICD-10 code, by the way, to persist for women.
Yeah.
I also think the doses in every single case are way too fucking high. Way too high. I also think that there is a time and a place. And what I don't think is that like, oh, it's just fine that everybody's on these and now, by X year, 70% of the population, it's like, okay, well, why 51% of the population had a type 2 diabetes diagnosis? Why is it 30 to 40% of the population now? Like it astounds me that doctors are some of the smartest people and yet the lack of critical thinking, it perplexes me. Like, oh duh, I don't know why is everybody so obese? Why is
Right.
this such a like because people don't like I mean this is so multifactorial and I do think that there is a huge mental health and trauma component to obesity too and that's not giving people an out. Like you are not responsible for your trauma but you're responsible for what you choose to do with it. And I am very very radical self accountability. Like I don't if you want to play the victim, don't come work with me.
Yeah.
I don't tolerate it. Like I will literally keep your money and tell you to go away. Like I won't do that. But you
Yeah.
know people like that they don't work with me. So I think that they're overprescribed and undersupported. And I think that when you start somebody on it, it should be a requirement that and listen, I'm not here to solve all of the fucking governmental funding shit, okay? But they need to be counseled about strength training, right? Because anytime you lose weight, you lose muscle. And we need
Mhm.
to do as much as we can to preserve that. We need to be counseled about a high protein diet, right? Not this, 50 grams a day, like the minimum RDA BS that we have going on, right? We need to be counseled about, seeing a dietitian, seeing a strength coach if that's possible. Like, and I would argue if people did these things, they wouldn't need the med anyway.
Right.
They wouldn't.
Yeah.
Like if you give me a person who has consistently strength trained, I'll even say 2 days a week. 2 days a week, they're hitting 8,000 steps a day. They're eating 3 meals a day, protein, fat, carb, fiber, and they're getting 7 to 9 hours of sleep most nights, 80% of the time. That person is not going to be obese.
Oh,
And in general, the bulk of them, the bell curve, right? Because there are always outliers with things, and there's leptin resistance and this and that and binge eating. I know that there are exceptions. I know that there's always people screaming about like,
Yeah.
when you work on the internet and you talk about strawberries, people scream at you about why you hate peaches. So I get it. There are outliers. However, I think that those things need to be put in place. And I think mental health therapy needs to be a big part of it because it's the behavior.
Mm.
People know what to do, but it's the mindset piece and the behavior piece that keeps them from being consistent with it.
Yeah.
So I just,
Well,
I have a lot of issue with.
oh, I worry about that whole appetite suppression with actual true nourishment and
Yeah.
how is their body going to be truly nourished if they're not eating, what they should
Totally.
be.
Totally.
Yeah.
I mean, it's creating you're creating like a permanent caloric deficit as long as someone is on that, right? And what, for anyone who's ever looked at a Krebs cycle or how ATP are produced, B vitamins, selenium, not N-acetylcysteine, but acetyl-CoA, zinc, all of these micronutrients are involved in that. And if you are under eating, that process is not being fueled. And so that is where all of these problems come into play. And so we're throwing these GLPs on people who are either metabolic dumpster fires and they're not getting the support that they need, right? Like the person who's 2, 3, 400 pounds, like, cool. I'm totally for that person using that as a tool.
Yeah.
I'm not for that person being given a prescription, given no guidance, no discussion of an end date, right? Of like, hey, like this is a temporary tool, no discussion about strength training, no discussion about eating. And I know that there are people probably screaming about PCPs only have so much time. Listen, I did it. I did it. I promise you, if you are a prescriber and you do not have good connections with a strength coach, DM me. I know plenty of them and they have app programming for $30 a month.
Yes.
And I'm sorry, but if you have an iPhone and you can't afford $30, you need my boyfriend's services for personal finance coaching. You have you have a spending problem, not a money problem. I know plenty of dietitians who have group support service, like a membership for $39 a month.
Yeah.
So I get it. I get that not everyone can pay out of pocket for my big one-on-one package but there are plenty of us giving out
There's so many
free
sources.
information
Yes.
everywhere. Find a
Absolutely.
person. I don't care if it's me or someone else. Find somebody who resonates with you and go consume their free information.
Yeah.
I have multiple people who have messaged me who have never worked with me one-on-one, but they've bought a couple of guides or they came to a free event and they're like, I was able to advocate better with my doctor. I quit drinking because of you. I promise you, like, you can still do it.
Yeah.
It might take you a little bit longer, or you might have to like, you don't have me in your corner, but I mean, hey, if you want to work with me too and you have the money to do it, like that's also great. But
Yeah.
I think that there's so many ways that people consume good, high quality information for FREE or really cheap. And again, if you're a prescriber, like if you're a doctor, PA, nurse practitioner listening to this and you need good quality humans, like please slide in my DMs. I'm happy to share my resources with you.
Yeah. Moving on into medical gaslighting and self-advocacy and what that looks like when you are working with providers. And if you are wanting to go on GLP-1s or you are wanting to go on HRT, this can be really important. And I want you to kind of maybe just share a little bit because we're running out of time. We're already at sorry. So I want to keep your time good. But so what does self-advocacy actually look like in a practice? So you've said it before, like you help women and people go into doctors' offices and just be more confident. What does that look like?
I think this is going to depend on what they're met with, right? So this is going in actively with, the top 3 questions that you want to address. Cause I also do understand that like, don't go in with a list of 20 things. Like that's not going to happen in a visit. So be organized and have your top 3 things that you want to talk about, have a list of labs that you would like ordered, advocate for yourself, talk about studies. Unfortunately, people have to go in like armed with PubMed IDs to talk to their doctor because their doctors are telling them that they don't need fasting insulin tests or vitamin Ds. And so go find the studies. Find the studies that say that you do and bring them in and be ready to fight for yourself. And I hate that it has to be that way, but it does.
Mm-hmm.
And you can fire your doctor. Like, I don't know if anybody ever told you this, but you can say goodbye. You are like, can I see someone else here? Like, and if you've really had the final straw with your doctor, I don't like to be a dick and this is not advice, but this is something that you could do. You could say, if you are unwilling to order labs that I am concerned about my health and my body, I would like you to put that in your note documentation, and I would like a copy of that printed out and sent to me. That'll get somebody's attention real
Oh
quick.
yeah. Oh yeah.
That'll get their attention real quick.
I always tell people to go in with like your husband or have someone come with you to just be there. Another person in the room can sometimes help.
It can for support. I hate that for the fact that like just the fact of a man being there, a woman is more likely to get what she wants. So I get it, and I also hate it.
I know.
I mean, listen, like I went through a big hair loss thing and I went to the dermatologist and the guy was giving me the runaround. I said, listen, whatever his fucking name was, I am not leaving here until you take a biopsy of my scalp. So what's it going to be?
Right.
And I don't care. I'll say that and I'll be bold and I don't give a fuck because like I had been through this it was post-COVID hair loss and I had all this inflammation and the guy was trying to like, I ended up doing a topical steroid, but I'm like, I want to know what's going on.
Yeah.
And he was like, "Oh, well, I'm like, I don't care about the cost because I was self-pay." And like the guy finally did it. So sometimes you really do have to be brazen with people, and you can do it. I wasn't a dick. I wasn't super mean about it, but I was stern. I
Yeah.
told him I will not leave the seat until you take a biopsy. Like I want to know what's going on. You're telling me you want to give me a steroid, but you're saying that everything like looks normal and so why do you want to give me a steroid but you won't take a biopsy?
Right.
Can you explain that to me? He couldn't. He couldn't explain it to me. And now, I mean, I'm going in there as a medical provider, right? Who I have that knowledge, but you just have to be ready to advocate for yourself. You have to be ready to hear no. And
Yeah.
that's so shitty to say. And I hate it. I absolutely hate it. And I hate the fact that when women go in with a man, they are more likely to get, and it's true. We have
It
studies
is. Oh
showing
yeah, absolutely.
disgusting.
My postpartum clients or my pregnancy clients, I am like, you have to take your husband in. He has to go with you because that's the only way that they're not going to bully you. And it's so
It's
freaking
gross.
ridiculous. It's gross, but it works.
I mean,
Sadly,
I would advocate to the women here if you are going to go in alone. I'm not saying to like go against what you're saying
yeah, no.
and be brazen.
Hmm.
Like be bold about it. Like this is your health and your life and you're paying for these services.
Yeah. Well, that's just, I mean, I worked labor and delivery and I was like, you don't have to do anything. You're paying for our services here.
Yes.
If you don't want to deliver in that position, you don't have to deliver in that position.
Squat over the
Like,
toilet if you
I
want.
don't give a shit. We'll deliver your baby on the floor. I don't care. So,
Yeah.
and
The
and and
whole
that
the
is
whole
where,
business of being born is really disgusting.
oh, yeah, it was rough. And now looking back, I'm glad I got out of it, but I'm really sad for those still in it,
Even the
unfortunately.
cervical checks, like you don't
Oh
like
gosh.
like how is this to any woman who doesn't want to have their cervix checked? Like just ask how is this altering your medical decision
Yeah.
making? That's it.
I
That's all
I
you gotta say.
actually just
Does not.
attended a birth that we from start to finish, she never had a cervical exam.
Imagine
Based on
that.
her
So weird.
birth, and she still had a live birth. Great birth, beautiful, unmedicated. Like it can happen, but they just aren't used to seeing it.
I mean, the rate of C-sections in this country is absolutely disgusting. The number of C-sections that occur because of a doctor's convenience and their
Yeah,
schedule. And listen, I know OBGYNs works. It's hard. It is.
it
It's
is.
really hard. I get it. And also like
Well, not even C-sections. Let's talk about uteruses, eating the ute. Like it's just like a scheduled procedure now. Doesn't even matter. You don't want it? Okay, let's get rid of it. They have
yeah,
no idea the importance that
for
it
the pelvic floor.
provides.
Yeah.
Yeah.
It's really, really sad the number of hysterectomies that are probably unnecessary because the doctors aren't asking the right questions, right? Women are coming in with heavy, painful periods. They probably have fibroids. I mean, didn't even touch on endometriosis,
We
right? And
didn't.
the number of women with gut dysfunction, that's the number one sign of endo is gut
Mhm.
dysfunction, not period problems, by the way. And yeah, it's going to open a whole other can of
Yeah,
worms, but endo and SIBO also do,
they
they
do.
hold hands a
They
lot
do.
and histamine issues are really
Yeah, I
prominent
feel
in there
like
too.
that should be the one that we talk about when I'm on your show. We should
Great.
go that route.
Yeah,
But
let's
yes,
do it.
I agree 100%. And I think so many things are just interconnected and there's so many things that can be prevented, but people just they don't have that information. So
No.
that's I think the main goal of sharing is just to know that there's other ways out other than just having a
Yeah, you
hysterectomy.
always you have options.
Yes, there's so many
Just
different ways to treat the body.
Yeah, I mean, you just need to know. I get knowing where to look can be difficult, but I mean, if you're listening here, it's a good place to start, right? And I mean, even if you're not a practitioner and you want to know other like-minded humans or like good resources, I will share my resources very readily at any point in time with people. So,
Same. I know I have a whole resource page on my website as well that yeah, it's there's lots of information out there and I think providers like you, providers like me, we all have this information that we are very happy to share. So just reach out. All right, well, let's close. Is there anything else that you have to add or that you want to add that you would like listeners to know?
oh, that's really broad.
Or maybe what is one thing you wish every high achieving woman would know
Oh,
about her body?
one thing every high achieving woman should know about her body. What your deal is. So, what is the thing that happens for you when your stress becomes too much? Because it looks different for every person. Some people get more prone to illness, some people have difficulty with their sleep, some people get moody, some people get very snappy. Know what that looks like for you.
Yeah.
And know I would even encourage you to know what it looks like when you get to the stage before it's too much, because that's when you really need to back off. Know what those signs are for yourself, because stress is such an under discussed risk factor for your health. It is the second biggest issue for blood sugar. Like, it will make you diabetic.
Mhm.
I've seen it. So I would say know those signs for yourself,
Yeah.
and know what brings you down. Like, know the tools that you have in your toolbox that actually like make you feel like you have a full body exhale,
Yeah.
and do more of those things.
I love that. Yeah, that's
Yeah.
perfect. Great. So, where can listeners find you, work with you, or listen to your podcast?
Yeah.
Share all your information.
Yeah. Yeah. So I hang out mostly on Instagram. I'm just at Danielle.Kepics. Super easy. I do have other accounts, Empowered Mind Body and Empowered Medicine on Instagram. There's a dot between each of the words. And then if you're a practitioner and you want, I did start a business with my RD bestie called Unconventional Collaborative. So unconventionalcollaborative.com or unconventional.collaborative on Instagram. We run a interdisciplinary virtual mastermind for coaches, practitioners, and trainers. So we bring in guest speakers every month. We host live events. We have a whole community platform of resources. So you can go and join instantly and get access to at this point in time, there's like, I think 50 different recordings of expert lectures from some really, really amazing humans in there.
Awesome.
Yeah.
Well, thank you so much for being on
Yeah.
the
Thank
show.
you.
And thank you, listeners, for listening. And we'll talk to you soon.
Bye.